Hello everyone, my name is Susan Abapalik and I will be presenting my poster presentation entitled Exposure to Community Violence in ED Patients with Non-Traumatic Chief Complaints. The objective of the study was to determine the prevalence of exposure to community violence and violent crime within a population of emergency department ED patients without violence-related complaints. This study came about from research that we had conducted, which showed that community violence is a public health issue impacting about 12.6 million adults every year in the United States, as well as that exposure to community violence is associated with an increased risk of behavioral disorders, psychiatric disorders, and other chronic diseases such as hypertension and diabetes. What we had done was a prospective analysis of adult ED patients who presented with a chief complaint unrelated to violence at one urban hospital, this being Cook County Health and Hospital Systems. A convenient sample of participants were administered a questionnaire regarding personal and close contact exposure to community violence by our trained research assistants. The questionnaire administered was adapted from the Survey of Exposure to Community Violence, the SECV, and the SECV measures lifetime exposure to community violence. And what we had done was adapted it for clarity, brevity, and to assess exposures within the past 3 months and the past 3 years. It measured both victimization and the witnessing of violence. We also added 2 items to this questionnaire. One was to assess emotional, verbal abuse, and the other was to address uncomfortable physical contact, which some respondents may not consider to fall under the previous category of sexual assault, molestation, or rape. All of our respondents were offered resources, which included a resource handout, which consisted of an array of different resources in reference to an array of different topics in the Chicagoland area, as well as a social work consultation, regardless of their responses. These resources were also offered to those who did not participate in the sense of filling out the questionnaire and or completing the questionnaire. This data was then analyzed using descriptive statistics. In total, there were 123 respondents. The age range was 19 to 86 with a mean average age of 47. And 57% of our respondents identified as female. Of our respondents, 37% reported witnessing violence and 68% being victimized. Of those who were reportedly victimized, 51% reported victimization within the past 3 years and 19% within the past 3 months. The data that I will be now discussing is in reference to the bar graph in the center of the poster with the title Exposure to Different Forms of Victimization. Of all respondents, victimization was reported from the following: slapping, hitting, or punching, 43% of our respondents; robbings or muggings, 31% of our respondents; physical threats, 29% of our respondents; verbal or emotional abuse, 27% of our respondents; physical touch, sexual assault, molestation, or rape, 20% of our respondents; being attacked with a knife, 13% of our respondents; being shot at, 11% of our respondents; and forced entry while home, 11% of our respondents. The data that I will now be discussing is in reference to the bar graph on the right with the title Prevalence of Witnessing Violence. Of those who reported witnessing violence, 93% reported witnessing an attack with a weapon, and 36% reported witnessing a person being killed by another person. 51% reported personally knowing someone killed by a violent act. In conclusion, exposure to community violence and violent crime is common amongst a population of ED patients without violence-related complaints. This data provides a strong argument for the development of efficient and effective ED screening mechanisms for exposure to community violence, but it also suggests a strong need for bridges to be built to resources for these patients, including therapy services, trauma social workers, psychiatric services, and law enforcement when applicable. Thank you for taking the time to listen to my presentation. I really appreciate it. If you have any questions or would like to follow up with me regarding my research, my email is susanepanek@gmail.com. I look forward to hearing from you. I hope that you have a lovely rest of your day, and take care. Bye-bye.